Welcome back to the County Agent Podcast. This week, our guests are Raymond, Cloyd, and Priscilla Brenes, and we are going to be discussing the alpha-gal syndrome and ways of how to identify it, what causes it, treatment, all things that we need to know about it. If we would, let's start with a couple introductions. Raymond, would you mind sharing who you are and what you're doing?
I'm Raymond Cloyd. I'm at Kansas State University in the Department of Entomology. I have a 7 extension, 30 research appointment. I handle all horticulture crops, greenhouse, nursery, landscape, turf grass, and terrascape conservatories, fruits and vegetables, Christmas trees. I work with the beekeepers, the pollinators, and we do handle urban issues, ticks, chiggers, mosquitoes, fleas, bed bugs, in the extension area. So yeah, those are portions of my responsibilities.
Priscilla?
I am in the School of Health Science in the College of Health and Human Sciences here at Kansas State University as well. And I am the nutrition state specialist for extension, and my work focuses on part of it on alpha-gal syndrome, but also on prevention of chronic disease, nutrition education, nutrition for children, women's health, and anything related with nutrition. I'm the person at K-State.
You bet. Well, Raymond, let's start with you and let's just talk about or share about, what's causing this? What's the vector for this syndrome?
Okay, so the syndrome is known as alpha-gal syndrome or alpha-gal syndrome, and it's primarily vectored by what we call the Lone Star tick. Amblyomia is the genera. And the way to identify a Lone Star tick is the female, not always, has a yellowish spot on the back of her body, and males do not. But what happens is they're feeding on vertebrates such as squirrels, possums, raccoons, or skunks. They acquire this molecule or enzyme called alpha-galactose. And so, as you understand, ticks is when they go from larva to nymph to adult, they have to have a blood meal. So after the larva feeds on a rodent, they fall off, become a nymph. The nymph feeds on another vertebrate, gets a blood meal, falls off, and then they become adults. So they acquire this alpha-galactose molecule from vertebrates that are out there naturally. Okay, so that's okay. But if a person gets bitten, not bitten, but if a tick feeds on you and releases the alpha-galactose enzymes molecules in your body, then your body forms antibodies to that antigen, like your immune system normally does. That's how some vaccines and other medications work. Okay, so the antibodies deal with that antigens, and that's how your immune response works. So everything's okay. However, meat products, pork and beef and lamb, they contain this alpha-galactose molecule enzyme. It's a carbohydrate-based molecule. So if you're eating meat, then your immune system responds to that antigen by, again, antibodies, and that's where you get that reaction, sometimes life-threatening. We know people that have been very, very sick for a long period of time, and depending on the titer level, and how long the tick feeds, that can dictate how long that you will be susceptible or should avoid eating meat products overall. Okay, so that's how the system works. Now, the best way to deal with this is to avoid getting it. So what you want to do is be sure to avoid tick areas such as unmanaged vegetation, and you want to take precautions by wearing repellents such as DEET or Picardian. They're out there. When you're outside, come in and check yourself, especially to keep the sea ticks. Wash the sea ticks off. Take a shower. Wash your clothes in the hottest water and then dry it at the highest temperature. So it's more prevention. So when the tick is fed on you, that's when you run the risk of getting the alpha-galactose or the alpha-gal syndrome, because of the transmission of the alpha-galactose into your body, and then your immune system responds to that. So we have a publication on ticks of Kansas, and it's all prevention. Stay on the paths, don't wander off into unmanaged areas. We recommend tuck your pant legs into your white socks so you can see the ticks. Wear a repellent. As I mentioned, DEET is the major one there, mainly because it gives you longer residual activity. And then after you're done, come back in, quickly take a shower, have somebody check you for areas where ticks can be located. And those are the ways to minimize the potential or prospects of getting the alpha-gal syndrome.
So, I've only heard of cases of this. It's more recently, I'm hearing more about cases. I've known one individual that maybe 15 years ago uh, has this, but is this something that we're seeing an increase in this, or is this, or how long has this been around? Is it relatively new?
I know 2019 we were getting the first inclinations, and that's when newspapers and then articles were coming out on it. So it is relatively new. It's much newer than the Lyme disease. But yeah, I would say between 5 and 10 years. And you asked a question just about, is it increasing? That's a difficult question to assess without the evidence, but more people are going out, and the more you're out there, the more you're exposed to ticks, especially between April and November. And if your area is known to have a Lone Star ticks, then you run the risk potential. The risk is higher in those areas.
Now, is the Lone Star tick something that's relatively new to Kansas, or has it been around for a while?
It's not new. We've had it for a long time. Yeah.
Okay. All right. Well, Priscilla, what's some of the stuff that you can share with us on your end?
Yeah, well, if you suspect you may have issues when, like Raymond said, like if you eat meat and then you get some reactions, it's important that you talk with your healthcare provider about the fact that you may suspect you have alpha-gal syndrome, because to detect for alpha-gal syndrome is not like it's not in the standard tick panel, so you might need to request it specifically. So you can talk with your healthcare provider and see if they can test or send you to get tested for the specific antibody for alpha-gal, because to be diagnosed with alpha-gal syndrome, you do need a detailed patient history of being bitten by a tick or being in areas that you're exposed to ticks. You need a physical examination from the doctor and that specific blood test. So, like if you suspect you may have it, or for example, there are counties in the southeast in Kansas that their neighbor had it, their other neighbor had it, they had symptoms, so then they went ask their healthcare provider, and then they got the test. So if a lot of people in your county start having it, maybe, and you think you have it, you suspect it, it's a good thing to talk with your healthcare provider about those concerns and see what can be done. And if you want to know about like the symptoms, so usually these in alpha-gal, compared to other allergies, the symptoms are very delayed. So for example, if somebody has a peanut allergy, those symptoms tend to be like within minutes of the person being exposed to the allergen. But with alpha-gal, you need to consume the product with alpha-gal in it. So that could be beef, it could be lamb, pork, organ meats, sometimes it could be dairy. But then all of those components in the food need to get digested and broken down in your body to get absorbed. So all that takes time. So there's a delay reaction between 2 to 6 hours from the time that the person ate that product. So that's one of the things that people need to be aware of. For example, sometimes people get a lot of reactions at late at night while they are sleeping, and they, get up and they get scared because of all the things that are happening in their body. And it's because, like they ate a meal around 5, and, it took 6 hours until those symptoms took place. But Some of the common symptoms are like swollen around the eyes or the mouth, coughing or wheezing, hives or itchy skin, some low blood pressure. If they have a severe allergic reaction to alpha gal, they can get anaphylaxis, and that's when the airways close and they, have a lot of trouble breathing. They can have shortness of breath. Sometimes they have the only things they have are like digestive issues, like nausea, vomiting, diarrhea. Some people just have joint pain, and that's one of the things that is very unique about this allergic reaction is that you can take two people with alpha gal and they may have very different symptoms when consuming alpha gal products that have alpha gal. And another thing is that just because, for example, you were bitten by the Lone Star tick today doesn't mean that you're gonna have symptoms tomorrow. That usually takes weeks or months to develop from the point that you were bitten by a tick. So it doesn't happen immediately, but a lot of people, they do remember when was the time that they were bitten by a tick, because usually maybe they had a severe reaction on their skin when they were bitten. And another important thing to know, and so to prevent people to get scared, is that not everybody that gets bitten by a tick gets alpha gal, right? It's not like every tick bite is going to give you alpha gal. As Raymond said, like it's a very specific cycle. And the tick needs to have alpha gal in the saliva to be able to transmit it to the body of humans.
Okay. So, are there any treatments out there that we are seeing very positive responses to? As far as, we mentioned that they'll have some issues with beef, pork, lamb type meats. Are we seeing any treatments that are helping reverse that?
Well, right now there's not a cure for this besides staying away from mammalian products or products that have alpha gal in them, and not getting another tick bite. So right now there's not like a cure for
Vaccine.
it. Yeah.
There's no vaccine for.
Yeah, there's no vaccines, or I mean, you can get an EpiPen if you have an anaphylactic reaction, that to help you with the symptoms of, the closing or the hard of breathing and all that. But there's not a cure for it yet.
Okay.
Yeah,
Oh,
Justin, I just wanted to include some information. As Priscilla said, not all Lone Star ticks are going to have it. It depends what they fed upon prior. But what's very important is to correctly remove the tick. We have, it's basically, you just take some tweezers, you go to the base where it's feeding and you gently lift it. You don't need to burn it or anything. And then you want to put that tick in alcohol and take it to a doctor. You don't want to flush it down the toilet or get rid of it, because you want to go to the physician to say, what do I run the risk of? That doesn't mean you're going to get it, but what is the potential risk? And that would be the same for deer tick or American dog tick or the other ticks that can vector, and many ticks can vector more than one disease. That can vector babiosis, anaphylaxis, anaplasmosis, those things. So it's important to get that tick identified, and we can do it by the adults, and then that'll help you go to the physician and determine, maybe later on I should have a test for the alpha gal, as Priscilla said, because you want that delayed effect, which is the same for Lyme disease. You don't, after you've been bit by a black-legged tick, you don't want to go to the doctor right away and get a whatever the PCR or the Western blot test, because your body hasn't developed the antibodies in sufficient numbers for those tests to detect it. So you want to wait a bit, but really keep that tick, put in a rubbing alcohol in a glass seal container and get identified. So then the doctor knows what you run the risk of.
so is the Lone Star tick prevalent throughout Kansas, or are we seeing more of it on the eastern side?
Well, it's going to be like the black-legged tick and the deer tick, where there's moisture, vegetation, and high population. I'm sure it's out in Western Kansas. But the environmental conditions are just not conducive. Ticks like moist, high humidity. So when you have dry conditions, that's why we recommend people weed eat or mow their lawns or their areas around their yard, because that creates a inhospitable environment for tick development. Okay, so yeah, it's good environment like temperature and moisture always has a big impact on insects and mite pests.
And speaking of like a yard treatment, I know several people that will treat their yards with insecticides. Is that beneficial? Does that help take care of the tick?
Yeah, that's always a question. It's kind of like the mosquito blanket applications, which are not useful at all. You don't know where they're at, but what I do recommend, Justin, is you do what we call a cloth drag method. You take like an old pillow cloth or something like that, and you attach it to a board, and you just go across an area, and the ticks will latch onto that. So that'll give you an idea of what the potential abundance of ticks are in that area. I don't recommend spraying a yard for ticks because you don't know where they're at. And depending on what you use, you can cause more damage to the ecosystem than you could by not doing anything. Yeah. I think we focused in on the areas as repellents, stay on managed area paths. When you're done outside, come in, take your clothes off, put them in a washer, and then take a shower quickly. Have somebody check you over for some of this more sensitive spots. That's really what's involved in tick management.
Okay. And this is the time of year that a lot of counties are going to 4-H camp, and they're probably going to be around areas like we've talked about. Should there be a reapplication of like the deets throughout the day when they're in these uh, camps?
You mean the children or
Yes.
yeah.
Yeah.
Okay, so when you're using DEET, you don't need any more than 30%, with probably for children about 10 to 20% active ingredient. But no, DEET has the longest residual activity. I think a 30% DEET, according to some evidence, is about 6 hours of protection. You put it on one time when you go out, and then you come back in because it's kind of an oily material. You take a shower, not only for remove the DEET, but also to remove any sea ticks, which are the larvae that you can't really see very well, get them off their body, because ticks, when they get on you, your clothing, they wander around a little bit before they'll start feeding. They assert their mouth parts, the chelicerae, and the hypostome is the main center area, which is barbed. So those are the main ways to deal with the ticks, as opposed to these blanket sprays. But again, I think one application of a 30% DEET, either your clothing or your skin, should provide you about 6 to 8 hours of protection. So there's really no need to go back and make a second application.
Okay. Well, that's one, you just never know. You've got these 4-H camps going on, and kids are in most of these camps are in environments with a lot of trees, tall grass, things like that. They may be going on hikes or fishing and didn't know if they need to reapply something after a couple hours or not. Um, what does it look like, Priscilla, like moving forward, if somebody has this, um, what's the kind of diet that can help them thrive and feel some type of normalcy?
Yeah, that's a great question, because when we think about what we are usually consuming and how much of that has alpha gal, uh, sometimes if we are very used to consuming a lot of beef, a lot of dairy, and we're having reactions to that, it can feel very overwhelming to all of a sudden not being able to eat it. Um, so, like you can need to stay away, from beef, from pork or lamb, but there are other options that may taste similar to beef or to pork. So, for example, some people with alpha gal, they are farmers. They have started to their farms. They have started emu operations to get eat their meat. But if you cannot do that, like poultry is a good alternative. Eggs, are a good alternative as well. And fish, also, all of those are good sources of protein. So it's important to understand how much we have to take out of our diet and what type of nutrients we might need to be, on the lookout for. So, for example, most people will react to red meat, beef, pork, lamb. And some people, about 30%, they also need to stay away from dairy, like milk, cheese, yogurt. Not everybody with alpha gal needs to stay away from dairy because they may not have a reaction to dairy. But it depends on how much you're taking out. So, for example, if you're taking out only red meat, but you can eat dairy, then you need to worry about where you're getting your iron from, your protein, maybe some of your B vitamins. If you're taking dairy out as well, then on top of that, you need to worry about where you're getting your calcium and your vitamin D. So, some of those you can get from poultry, iron, but you can also get a lot from beans, peas, lentils. You can get iron there. Um, you can get some of the B vitamins. You can get iron also from dry fruits and raisins. And if you're worried about calcium, you can get fortified juices with calcium. You can search for the labels at the supermarket. Some plant milks, like soy milk, will have a good source of protein, but also some of them are fortified with calcium, so you can get that calcium from there. But also some of our vegetables have calcium in them, like kale, broccoli, bok choy, and you can make those in a stir fry and eat some of your calcium from there. And people worry a lot about protein, especially if they rely a lot on red meat. But poultry, fish, lentils, chickpeas, beans, tofu, eggs, seafood, all of those are good sources of protein that people can start incorporating into their diet.
Is there a chance, I think one of you said the symptoms aren't always the same for everybody. Uh, we have a lot of hunters in our area. Would there be a concern with deer meat or elk meat?
Well, they
Or
are
is it
mammals, so they will have alpha gal in them. So they may have a reaction to those as well.
okay? Could be more of a case by case situation.
Well, yeah, because as we mentioned before, not everybody has the same symptoms and not everybody reacts to the same foods, but most people with alpha gal will react to beef, pork, and lamb.
Okay.
So it will be, um, just, I would say, just be careful with what you're consuming. And if you are, hunting for those, uh, if you eat them, just make sure that you are aware that of that delay reaction and monitor yourself. And you maybe keep a diary of the things that you're eating and when you have symptoms so that you can identify specifically which foods are the ones that are giving you reactions.
Okay. Is there anything that we haven't discussed that we need to?
Well, one thing that as a scientist I think about is what why all of a sudden, I mean, why in 2019 did we start getting this alpha gal syndrome? And I'm wondering, looking back at literatures, has alpha galactose been in populations of mammals, and then all of a sudden it evolved with the tick? So there's some questions we're trying to figure out is, okay, is this a rapid evolutionary process, or is this something that just is a random incidental aspect? So that's one of the questions that's kind of we're asking ourselves, kind of like Lyme disease. We know Lyme disease showed up in the 70s, 75 in Lyme, Connecticut. There's some speculation why it was right near a bio weapons plant, but that's another issue. But it says has alpha galactose, and that'd be an interesting study is go back and sample animals and figure out, what's the prevalence of alpha galactose in their system And can you track that back to animals 10, 20 years ago? So just sort of a question that I've had. And then why the Lone Star tick? I mean, why not the American dog tick or the black-legged tick or dog tick or others? So those are some questions as a scientist we're sort of looking at or should be looking at to address some of these issues.
You bet.
Yeah,
You
and
bet.
I also wanted to add that people with alpha gal also need to be careful of their medications, because a lot of the medications, and this is why, or this is how alpha gal started getting in the medical literature, because of the people were having reactions to some medications that contain mammalian byproducts in them. So medications like gel caps, if they have magnesium stearate, gelatin, collagen, any medication like that that has some mammalian byproduct can contain alpha-gal and then can give the person a reaction. So medications are also something that they need to be aware of. And if they have alpha-gal, it's important that whatever medical procedure of any kind they're gonna get, whether that is dental, something on their eyes, a big surgery, a small surgery, that they make sure that all their team of healthcare providers know that they have alpha-gal, so that they can search for the medications that may cause a reaction, because the last thing we want is for you to have a reaction in the middle of a medical procedure, and people don't know about it.
I think, Justin, the issue of this, the knowledge gaps is like, okay, you mentioned hunters, where are the deer, the elk getting the alpha galactose from? And then the area, and then see, again, not all Lone Star ticks are going to have it. And that's why we suggest you keep them in some samples, so then you can wait those 7 days and then get tested. And if it comes back negative, okay, you're fine. You can go to the Texas Roadhouse and eat your favorite meat, whatever, basically. So there's a lot of questions, figuring out, the evolutionary process of this is kind of, there's a lot of knowledge gaps there. Okay. But I think the main emphasis is prevention. Try not to get it, basically. And we've already talked about that. And then Priscilla has provided, what do you do diet wise when you do have it? And then there's how long does it last? And that's going to vary with the individual and the titer level of the alpha galactose that was in the system that was injected into the body through the saliva of the tick. So I know when I give talks on ticks, somebody will come up and says, well, I had alpha gal syndrome, now I don't. Okay. And somebody will say they've had it for 5 years and they still can't eat meat products or animal-based products. I mean, I think they can still eat fish and chicken or poultry, but yeah, there's a lot of variability there associated. Like anything in nature, there's a lot of variation that can occur.
So Raymond, if somebody, where do we need to send a sample of a tick that's caught? Is that just taken to the local health department, or is there a specific lab that's recommended to take those to for identification and analysis?
Okay, so we don't we don't analyze for alpha galactose. But if you find a tick on you, and it's probably going to be by the time you see it the adult, you can remove it, put in isopropyl alcohol, rubbing alcohol, and then send it to the Department of Entomology here at Kansas State University, and I can take a look at it. Yeah, so
Okay.
they can go through in terms of IDing the vector or the source of alpha gal. They can send it directly to the Department of Entomology, attention myself. Now it has to be an adult. We can't use larvae or nymphs because they don't have the morphological characteristics we use for identification. But yeah, they can send it to Kansas State University Department of Entomology.
Perfect.
And the Department of Entomology also has a website on alpha-gal syndrome. And some of the resources on that website are one of our extension publications on alpha-gal syndrome 101 that explains the symptoms, how it gets diagnosed, and a little bit about the nutrition side. But also we have there other trusted resources. And the University of Missouri Extension also put out some good publications specifically on nutrition and how to substitute some products. So you can go to the entomology website, AlphaGal, and you can find some of the resources there.
But we will put all that information in the notes of this podcast with the links, and people can utilize them if they want to. Um, Anything else we need to talk about with this?
One last thing I wanted to do on the nutrition side is that if you have alpha-gal syndrome, it's very important that you get very savvy at reading labels of products, because some flavorings that the industry uses, like flavorings, lubricants, moisture, uh, to increase moisture in foods, or things
Dyes.
they use as binders. Yes, like all that. They may come from a mammalian byproduct, and those may have alpha-gal. So even if the product, let's say, is made out of plants, if they have some of these mammalian products that have, alpha-gal to just help with texture or help with moisture, they may have a reaction to that because of those byproducts. So they need to get very savvy at reading those labels.
There's also the issue, Justin, about people that how it reacts with your medications. Is it antagonistic or synergistic? So, that's another aspect that I think there's a knowledge gap on, especially, older people taking multiple medications, which could impact their immune system somehow. That's also an important thing to consider.
Okay. Yeah, we deal with a lot of youth in 4-H, and that's one of the things that we have to do every time is go through, see if anybody's got an allergy of some sort, and then make sure that if we've got snacks or a meal, that we are not serving that to them. It just seems like we see a lot more kids or youth today that have different types of allergies at that. Um, Used to be peanut was the common one, but there's a whole lot more out there now. And so it is very, very important. Always read labels. Okay. Well, I appreciate your time this morning. And if there's nothing else, we'll go ahead and wrap this up. And I hope you two have a good rest of the day.
You
You
too.
too. Thank
Yeah,
you.
yeah. Thank you. Have any
Bet.
questions? Just let us know.